What I'm seeing is that there's a part of the stomach which is really thick.
On this episode,
I think there's enough to warrant a surgical biopsy. It is concerning. This isn't what we expect. This does look scary.
Okay, so unfortunately I can't hear any gut sounds. Because his intestines and stomach aren't moving, it can get to the point where they rupture. Especially in a bunny this sick, we need to get that fluid in quite quickly. God, he's so flat, isn't he? Can't even see the vein anymore.
but first,
He's been with me through some very dark moments.
Oh, good job. Very likely it will get worse.
Yeah. I literally don't know what to decide. Good boy, Archie. There you go. Good boy, Andrew.
at Sash in Sydney, it's going to be an emotional day for Lauren, who's bringing in her adored Great Dane Archie for cancer treatment.
Good boy, Archie. Archie came into my life as an angel. Good boy. He means the world to me. What are you doing? My partner and I adopted him and we were both absolutely smitten. And then my partner passed away unexpectedly. And Arch was home that night on the bed. And Arch has literally been on my bed every night since. I don't know what I would have done if I hadn't had him.
Still shattered from her recent loss, Lauren has been dealt another cruel blow. Archie is battling cancer.
Hello, Archie. Hello, how are you? Nice to see you. Nice to see you. All right. Hello. You're leaning on me again.
Dr. Veronica has been treating Archie for the advanced cancer in his front right leg for several months.
How has he been?
He certainly still will offload weight and lie down when
And that's
he
natural.
can.
Yeah, it will be natural. Archie is a 6-year-old Great Dane and he was diagnosed with bone cancer. He had a CT scan, tried to find out where the disease is, and at this moment he doesn't have disease elsewhere. But if you put quarter of your body weight on the leg, which has bone cancer there, it's quite painful.
There were moments of he was weight bearing far more comfortably.
Even today, I can see he is putting so much more weight on it. That's amazing. So at this moment, we are in the process of radiation treatment, chemotherapy, which is the monthly infusions. So this medication gives him pain relief as well as makes the bone a little bit stronger. And the pain management is working for him. So he is using the leg at this moment. The problem is we can't predict how long for.
All right, Archie, should I take your giraffe with me?
Yeah.
I'll take your
the
buddy.
giraffe head.
Yes, I know.
This is too funny.
Oh my goodness. All right, you come in with me.
Come on, you're such a good boy.
With the cancer now extremely advanced, Veronica has advised Lauren to consider having Archie's leg amputated.
Thank you. Come on, Archie, come on. Oh, good boy, yes. Mommy is staying here for a little bit.
Today, he'll undergo tests to see if he will still be able to walk on just 3 legs.
Hello, my boy.
I just want to be making the decision that gives him the best quality of life. I don't want to put him through major intervention and adjustment if the cancer's just going to pop up somewhere else tomorrow. And it's brought a whole new perspective to my love for Archie.
I'll see Charlie, the rabbit, the bunny, yep.
At Sash in Western Sydney, emergency vet Alex is on her way to meet worried owner Keith, who's concerned about his pet rabbit, Charlie.
Hi, I'm Alex. I'm one of the vets on today. Would you like to bring Charlie through to the consult room?
Yep.
Follow me. Rabbits are quite fragile patients. They're a prey species, so they're constantly looking out for predators. They are scared of dogs and cats and other animals that we have in the vet hospital, so we do have to be aware of their needs. So what's been happening with Charlie?
This morning when I went to feed him, he was just over the far cheek. Usually he's very excited when he knows he's going to be fed. So he's off his food and just looks very, very sad actually.
And is there anything that he could get into that he'll eat? You know, like any things that don't digest? Fabrics or?
No.
He doesn't eat things he shouldn't.
He'll eat everything.
He eats everything.
Charlie's 6 years old. My wife got him as a present when our dogs died, so he's become part of the family. We've got 4 rabbits. They've all got different personalities. He's the oldest. He was the dad, the granddad, I suppose now, and he's just playful, you know.
So we'll just have a look at Charlie now and just see if he's got anything that could be causing him to go off his food today. So I'll have a little look at his mouth. There we go, it's all right. And we'll just have a listen now to his heart and also to his gut sounds. Okay, so unfortunately I can't hear any gut sounds, and normally the rabbits, their intestines should be moving all the time, and so if we don't hear anything happening in there, they can have a condition called gut stasis, which essentially means their intestines have stopped moving and then gas buildup happens. So Charlie's in a pretty bad way tonight. He's quite dehydrated, and I'm very concerned about his condition, and unfortunately this is a condition that can progress to being fatal. Sometimes when they have this gut stasis condition, their blood sugar level can get quite high. That can indicate is a blockage. Rabbits can't vomit, and so what happens is their intestines just fill up, and it can get to the point where they rupture.
Oh, mate.
He had 2 doses of radiation and infusion 2 weeks ago.
At SASH in Sydney, Veronica is introducing Archie to sports medicine vet and physiotherapist Naomi, who will assess the Great Dane's suitability for a leg amputation.
Hey matey. It's very nice. It's lovely.
I would really like to make sure Archie is able to use his other leg in the front after amputation. So Dr. Naomi is really great in assessing, does he have any issues with his shoulder or elbow? We just want to make sure that we do everything to assess how well he can do after the amputation.
Hey, and I'll swap sides with you, please. So good. My good boy.
If Naomi decides Archie couldn't enjoy a good quality of life without his front right leg, he'll go into palliative care for the remaining months of his life.
Can you have this leg? Oh, good job. Good job. His elbow feels pretty good. Wrist feels fine, and he's nicely muscled on the left-hand side. Obviously, he has wastage on the right because he hasn't been using it.
Yeah.
And surprisingly, he's very happy to wait there on this right-hand side today, which is great. Hey, my boy. All right, good boy.
After giving her verdict to Veronica,
You'll probably have a sense of how he would do on 3 legs from how he was at his worst, right?
Naomi sits down with Archie's devoted owner Lauren to share her thoughts on what's best for his future.
I think the good things for Archie is that his left front leg, he's got good muscling, he's quite comfortable in all of his joints. I can't see any obvious abnormalities on that side, and he's really happy to shift his weight over there. But if we take away a leg, he might struggle just to get up and about in general, and he probably will be less active. We can mitigate that by setting you up with a harness or assistive devices to help him walk, but very likely as the cancer continues to grow, it will get worse.
Yeah.
And we anticipate reaching a point in these cases, they often end up on 3 legs anyway, because he's going to be so sore that he's not going to take weight on that leg, and you're going to end up managing them the same way.
Seeing him in chronic pain and then having beautiful Veronica say, with amputation, he could be pain-free. So I was like, this is not fair, he's suffering. But then There's the human associations to amputation, to not being whole, to not being complete, to maiming. And it's such a dilemma in terms of how he did respond to your assessment.
Yeah.
Do you think he'd have like a reasonable chance of adapting?
I think he'd
like
cope with help. It's really about choosing the consequences that you feel best able to cope with, right? And for him.
Yeah. I literally don't know what to decide. He's my angel.
Just at the moment, because his intestines and stomach aren't moving, we do have to start with injectable medications.
Okay. In Sydney's West, Alex must act quickly to try to save 6-year-old Charlie, who has a potentially fatal stomach condition that stopped him from eating.
He is a bit dehydrated as well, and that's going to contribute to him feeling lousy and not wanting to eat and drink.
Owner Keith is extremely concerned for Charlie. He previously lost a rabbit to the same gastrointestinal condition.
So I had with one other rabbit, and there was probably a little bit delay in getting treatment, and I tried to treat him at home after seeing the different vet, and he just passed away overnight.
Sometimes they just need a little bit of time in hospital, and we can treat them with the medications, and it's just 12 hours or even 24 hours. And if he starts eating for us and he starts pooing more regularly and his gut sounds improve, then we're happy for him to go home.
But I'm sure he's going to be in good hands, and we'll just see how he goes through the night. He gets his guts working again.
Hi, Kristen. So this is Charlie.
Hi, Charlie.
Isn't he cute?
Hello, aren't you lovely?
Yeah, so Charlie's unfortunately got a bit of gut stasis. So we're just going to look at his teeth. Hopefully Charlie will be a good boy. So we're just having a look to see if there's any ulcers or any areas that might be rubbing or causing him some discomfort when he's eating that could have caused him to stop eating and then develop gut stasis. There we go. Oh, that's a really good image. So I can see that he has some sharp points on his teeth here, and they might be causing him a little bit of dental pain. Once he's recovered from his gut stasis episode, once he's feeling a bit better, he's on painkillers, then we can look at having those teeth sanded down so that they're nice and comfortable for him when he's eating.
But right now, Charlie's most urgent need is fluids to reverse his dangerous dehydration.
We need to rehydrate him, and one of the best ways to rehydrate is to give intravenous fluids, especially in a bunny this sick. We need to get that fluid in quite quickly. Dehydration is making him not wanting to eat and drink, and he's just going to continue on that path, and eventually it can be fatal. God, he's so flat, isn't he?
In rabbits, the ear is one of the few viable places an intravenous cannula can be inserted.
We'll milk some of that blood into the vein.
But Charlie's extreme dehydration isn't going to make Alex's job easy.
Can't even see the vein anymore. It's gone.
Good boy. Good boy.
In Sydney, Lauren is taking her soulmate Archie for a walk before deciding if she'll proceed with surgery to amputate his cancer-ridden front leg.
Hearing the physio say he'll end up with 3 legs anyway because you won't be able to weight bear on it because of pain, and then it's like, well, then he'll have 3 legs plus pain. That really struck me.
What are you doing?
I've said to him, what do you want, Arch? Like, let me know. I think he was like, I've still got stuff to do here. No, I'm not quite done yet. We got this, Angel.
Okay, come back.
Later at SASH, Archie is undergoing a heart scan to make sure he's fit for surgery. The lovable Great Dane has passed with flying colours.
With the amputation, it means that he can have a great few months. That's what's really good.
With her good friend and Archie babysitter Louise by her side for support.
Are we coming in here? Hello. There we are.
Lauren is ready to tell Dr. Veronica her decision regarding the amputation.
He's been a very good boy today.
He's been with me through some very dark moments. And I've said to him, this is about you, Arch. It's not about me. So he has to have the amputation. I just want him to be happy.
All right. I know it's a hard process to go through.
Thank you.
Thank you.
Lauren's heart-rending decision means Archie will have surgery to remove his leg tomorrow morning.
Aren't you the cutest giraffe ever?
Everything's gonna be okay.
In Miami, Michelle and Gaston are trying to put on a brave face as they arrive to see new member of the Bondi vet team, Dr. Edward, with their 2 beloved King Charles Cavaliers.
Hi.
Hi, good afternoon. How can we help you?
We're here to see Dr. Edward.
Wonderful. Have a seat. We'll go on ahead and get it for you.
Thank you.
Of course.
They're extremely worried because 11-year-old Harley has been suffering serious intestinal issues, and lately he seems to be getting worse.
He hasn't been well for the past 3 or 4 months. Been from diarrhea to ongoing vomiting, and he'll get better and then he'll get worse again, and I would just like to figure out what's going on with him so I can get him healed.
Hey kiddo, you're not Harley, this is Stella. Hey sweetheart, look at
Here
you.
for moral support. And this is Harley.
This is Harley. Hey buddy.
He's sick.
Yeah.
We're hoping you can help us figure out what's wrong with him.
Absolutely. All right, well, if you'd like to follow me, we'll have a chat. Michelle and Gaston are naturally really concerned. I mean, they've actually seen this thing progress to the point of where he's now almost as sick as he was when he first came here. Up to you. And we all want to get to the bottom of this and figure out what's going on so we can best treat it. All right, so let's get him on the table. I'll give him a check over. Hey, buddy boy, don't be afraid, eh? Hey, kiddo, let's have a look at you. Hey, good boy. The fact that Harley's 11, it does warrant more concern than if he were a younger patient. Age is not a disease, but it's associated with diseases. That sounds good. And an 11-year-old dog with these symptoms, this is concerning. We are worried about more complicated things. Yeah, he doesn't really seem to have much of a bladder there. So what that reflects is quite simply that we're dehydrated, and that makes sense. I mean, if we're vomiting and we're not eating and we're not drinking as much water. But my big concern is to do with, of course, the stomach. And on the ultrasound last time, there was an area of the stomach which was thicker than what it should be, right? It's about 1.9 centimeters, which is, much thicker than it should be. So what I'd like to do now is I'll give him an ultrasound to check on that region of the stomach to see if it's still thick, and then from there we can decide what else we need to do. All right, Harley. Come on, Mr. Man, let's go. Good boy. Thank you. Ultrasound's a great way to have a look at the gastrointestinal tract, the abdominal cavity. It's quick, it's easy, and it's non-invasive. Sorry, little man, a bit of cold.
Hey, darling. It's okay.
At Sash in Sydney, Lauren is spending some precious final moments with her much-loved Great Dane, Archie, before he undergoes surgery to remove a cancerous front leg.
If we've got the gift to be able to take away his pain, that's what counts. And yeah, we're gonna do this.
Good morning. Hi, Lauren. Hi, Archie.
Come on, Angel. Come on. I'm nervous. I'm feeling the vulnerability for him. He's my constant and my safety, and that's why this is so hard.
Thank you.
That's all right. We'll see you soon. Come on, buddy.
Come on, good boy. Bye, Angel.
First, Archie will be put to sleep by anaesthetist Maya.
Do you want to drop that to maybe 1.6?
She's been overseeing the 6-year-old's pain control treatment during weeks of chemotherapy, leading up to today's operation.
My primary role in Archie's case is just to make sure that his quality of life is preserved. So for Archie, we combine different pain relief medications together.
It's a lot to clip. Massive job.
As well as managing the anaesthetic process throughout the operation, Maya uses ultrasound images to carefully guide nerve-blocking needles into key areas of Archie's body. This will minimize pain during and after surgery.
1, 2, 3.
Specialist cancer surgeon Tristram will be responsible for removing Archie's front right leg.
We good now, my friends?
We're just having a look at the stomach now. There is concern for it to be something more serious.
In Miami, Edward's alarmed at the changes in Harley's stomach after the elderly King Charles Cavalier's bouts of vomiting and diarrhea recently worsened.
What I'm seeing is that there's a part of the stomach which is really thick. So it's much thicker than it should be. It's about 2 centimeters. And what that could represent, I mean, it's hopefully just inflammation, something like a gastric ulcer that we can treat through just medication. I am worried about Harley. There is that chance that it might be something more than just inflammation. Honestly, my mind can't help but go to something like gastrointestinal lymphoma or some kind of cancer. You know, hopefully I'm wrong. The concerning symptoms with Harley, for sure it's the weight loss. That's one of the bigger worries. The lack of appetite, the vomiting, the lethargy, it's all pointing to something perhaps more complicated than just a simple stomach upset.
X-rays will hopefully provide more answers.
We're looking for any evidence of spread of cancer, given that's one of our concerns with the stomach, as well as any kind of evidence of infection. He's been vomiting a lot, and a condition that can occur is when dogs inhale the vomit, they can get something called aspiration pneumonia. So we're checking for that as well. All right, so fortunately everything seems to be in line with this mass within the stomach or this area of thickening being benign. It's consistent with exactly what we're hoping for, a completely normal chest.
Edward's also checking Harley's blood to look for any more clues as to the little dog's deteriorating condition.
The white blood cell count is a little elevated, but that's to be expected. It's more inflammation than infection, so again, that's kind of what I was expecting, but it's only mild, so no worries there. This is very good news for Harley. So far, x-rays, blood test, it's all consistent.
Edward now has to update anxious owners Michelle and Gaston.
The ultrasound does look similar to last time, so the concern remains, you know, why is that stomach lining, why is it so thick? We're hoping it's inflammation, gastritis. That's something we can use medications for and it should be fine. But given how initially he was really sick, I think there's enough to warrant a surgical biopsy. What that means is we're going to remove a segment of that abnormal tissue to have a look at it under a microscope, and then that can tell us why is the stomach lining thick. We're thinking worst case scenario stuff here. All right, we'll get things sorted.
All right.
Come on, Mr. Man, let's go.
Thank you.
No worries at all. We want to decide, is this something benign, something inflammatory, or is it more something sinister? So what we're doing now is pre-oxygenating Harley so that when we begin to induce anesthesia, it's going to be as safe as possible. Good boy.
Now hopefully he doesn't jump or move.
In Western Sydney, Alex is struggling to get an intravenous drip into the ear of 6-year-old rabbit Charlie, who is dangerously dehydrated.
The vein doesn't look to be very good. Rabbits have very tiny veins on their ears, less than 1 millimetre in size. It's very tricky to place an IV cannula in such a tiny veins. And in Charlie's case, he's quite dehydrated, so those veins are absolutely tiny. There we go. Success. Blood glucose next.
Alex was able to carefully place the cannula into Charlie's delicate vein.
Very good job.
Alex is now checking Charlie's blood sugar levels. A high reading could indicate a deadly buildup of gas in his stomach.
11.1. That's a little bit high, but I think Charlie's a little bit stressed from being in hospital, and that's acceptable for him. If it was much higher, more than 12 to 15, then we might be concerned about a blockage.
Charlie is given medication to reduce the pain in his abdomen.
You take him down to...
Yes, I'll take him
Exotics ward?
to Exotics, and we'll get him started on his drip.
Good job, Charlie.
Thanks.
Good job, no worries.
But there's one last vital thing Alex wants to do before beginning the rehydration process.
So we'll be trying to give him supplementary food, so it'll be like a blended hay diet that we syringe into his mouth every few hours to try and help get his intestines moving, because while they don't have any food, they're just going to be developing gas. It actually smells really good. It's apple and banana flavour. It actually smells really tasty. Hey, Charlie, yeah. Oh, there's a good boy. Look at him go, good Charlie. Yeah. Look at him, he's almost drinking it. Good boy, yum, yum, yum. I'm really happy that he's eating now, because when they stop eating, their intestines will just stop working. And if he enjoys it, that's even better. Hey, Charlie, yeah. It's an encouraging sign that he's eating, but we're still in early days. We still need to correct that dehydration and then make sure that he's able to eat on his own without us having to syringe feed him that blended diet. So we'll get you into your accommodations over here, Charlie. Okay, Charlie, we've got your fluids here. So we'll just get you started on your drip.
It'll be a tense night of ongoing feeding and constant monitoring to see if Charlie's dangerously low fluid levels return to normal by morning.
Good boy, Charlie.
Because he's so large, it might be worth grabbing some larger sponges.
At SASH in Sydney, Dr. Tristram has made a positive start to the amputation surgery of Archie's cancerous front leg.
Excellent. People often ask us why we take the whole leg, given that the cancer is actually inside the lower limb. But the reason for that is that if he's not going to be walking on this limb again, there's no point in leaving any stump of the limb, because when the muscle atrophies away, it's just going to be uncomfortable for him. So we can make it much more comfortable if we take away the whole leg.
There is no upper limit for size for a dog undergoing an amputation. Even very, very large dogs like Archie can do extremely well. Their overall outcome in terms of their movement, their ability to return to exercise is just the same as if you were a small dog.
Interestingly, in dogs, the only attachment of the forelimb into the body is muscle, nerves and blood vessels. They don't actually have a bony connection because they do not have a collarbone. So different to us.
It's incredibly important that we don't cut into the axillary vein where it may draw air into the heart and lead to an air embolus, which can be immediately fatal.
This little instrument will allow us to cut and then seal blood vessels without suture. Like that, no bleeding.
The moment when Archie is separated from his diseased limb has almost arrived.
So we're just tying the artery now, so the pulse to this leg is now gone. So we actually watch his heartbeat. There we go.
Archie's front right leg is now gone. Hopefully, so have all traces of cancer from his body.
His prognosis with respect to his cancer, about 20% of dogs with his diagnosis do go on to live beyond 12 months and some years after surgery. While I'm closing Archie's wound, I need to pay careful attention to make sure there's no ongoing bleeding or oozing of fluid so that we don't end up with significant complications post-surgery.
Okay, there we go. All right.
I'm very, very happy with how the surgeries proceeded. We had no bleeding and the closure of the wound went very, very well.
Come on, Archie. Let's bring you out, buddy.
My expectation is that Archie is going to resume most of his normal activities as he could do on 4 legs, on 3 legs. Climbing stairs, running, jumping, playing at the park, and even playing fetch with a ball. All should be things that Archie can adapt to very quickly over the coming 2 to 3 weeks.
Gorgeous boy, hello.
Good boy, good boy.
In Miami, Edward's about to begin a biopsy of Harley's thickened stomach lining to try to pinpoint the cause of the little dog's worrying vomiting and diarrhea.
Okay, let's get him intubated. So what I'm doing now is expressing his bladder, so we want to keep it as small as possible to minimize its interference.
Suddenly,
it's not good.
Harley's heart rate escalates dangerously high.
His heart rate should be nowhere near this fast. It's about double what it should be normally, and we want to get it normal as soon as possible because he's already under anesthesia and we don't want to waste time. It is concerning. This isn't what we expect, especially given how there's no painful procedure going on right now, so we would expect a low heart rate. But the fact that we're high, we're just trying to piece together why that is and, of course, what we can do to get things normal again. Beautiful.
With Harley's heart rate now stabilized, Edward can begin the biopsy. Edward will be assisting lead surgeon, Dr. Rebecca Lynn.
Because Harley's growth is so thick, we can't really use an endoscope to go get a sample. So what we have to do is make an abdominal incision to actually have access to the stomach physically. I think there's a nodule at some point, but it looks to be benign.
I can't believe this poor guy can.
We want to get a representative sample, so we're taking a segment of this thickening to make sure we get an accurate diagnosis. Our concern is very much to do with the fact that the stomach is so thick. I mean, just feeling it, my mind immediately goes to the worst case scenario. This does look scary. So we're just finishing up Harley now. Unfortunately, it doesn't look good. The wall was really thick, much thicker than I was anticipating. We're going to be sending that biopsy away. We're going to be keeping our fingers crossed, but it doesn't look good.
Up, come on.
At Sash in Sydney, Alex is waking Charlie after a long night trying to get his dangerously low fluid levels back to normal.
Looking much brighter. Okay, let's have a listen to your guts. Just see if we can hear those intestines moving now. That's great. I can hear some gut sounds in there. Starting to make some good progress, Charlie. We do have some gut sounds now, and he is looking a little bit more hydrated. He still needs a little bit more time on the drip to correct that dehydration completely. So yes, it looks like Charlie is on the road to recovery, and I've got my fingers and toes crossed that he'll make a full recovery. Good boy, Charlie. Hopefully we can get you home soon and you'll be on the mend and back with Keith. How's that sound?
Hello.
Hi Keith, it's Alex calling from the Small Animal Specialist Hospital just with an update for you on Charlie.
Charlie's owner Keith has had a sleepless night, worrying about the little bunny he loves like a family member.
So I've got some good news, Keith, so we can hear some gut sounds in there, and we've got Charlie on the intravenous drip and correcting his dehydration, and he has also started to eat. He's looking a little bit brighter. Keith's got a soft heart, and I think he's concerned and unfortunately lost a rabbit previously, so we're treating Charlie intensively. We want to make sure that Charlie can be reunited with Keith once he's more hydrated and eating and passing feces.
Okay, thank you very much.
Okay, fantastic. Bye-bye.
Bye.
Good boy. All right, Arch.
Hi, darling. Oh, yeah, no, Nicky. No, Nicky.
In Sydney, Lauren has arrived at Sash to take Archie home after the life-saving amputation of his front leg.
The main feeling is honestly gratitude for his spirit and the team and the care that he has had. So relieved for him. To see him relaxed and comfortable, massive relief. Good boy, Angel.
Yay!
Good boy. Good boy.
Good job.
Good boy, my love.
Rehab therapist Alana shows Lauren rehab drills Archie will need to do at home to get him back on his feet.
We'll encourage him to come up onto the step. Good boy. Good job.
Good boy.
So we're loading up his back legs because obviously they're going to have to do more work now. And we want to do this sort of twice a day, ideally. We want to do about 6 repetitions.
Oh, wow,
his goal.
okay.
He's very eager.
Yeah. I'm blown away. He blows me away.
You ready?
He wanted to stand up hours after the operation, and he was walking the next day. It's just remarkable.
It's all right, we're going to do wheeze. Go do a wee.
So thank you. So thank you. He's teaching me so much. I have so much to learn from him. Good boy. Good boy. So I think humans have so much to learn from animals. And I probably underestimate how much animals just have the drive to get on with life and living. And that's totally what I've seen with Arch. You gonna come home?
Yeah, see how he's doing.
In Sydney, Audrey and vet nurse Bree are making a house call to check on an unusual cat.
Off to see our little man.
I know, I'm excited to see you.
7-year-old Nero, who lives with his devoted owner Simone, has some unique communication skills.
Nero. Hey. I told you it's your day. I know. I'm an animal communicator. I do animal communication for clients. I also teach it for beginners, and all the students have fallen in love with him, and he tells them, I go, don't tell them our secrets. And sometimes he does, and they love it. We've got to have manners. What have I always said? We welcome people into our home, don't we? Thank you. Nero chats to me all the time, tells me what's going on in his world. I tell him how my day's been. I've got to go out. Where's my food? Come and feed me. Some people think I'm strange until they know that I do animal communication. They go, oh, that's what it is. But they'll, yeah, a little bit crazy.
Hi, Simone.
Hi, Audrey. Hi, Bree. Nero's waiting for
Oh,
you
is
too.
he?
Yeah.
Audrey has been keeping an eye on a number of ailments Nero is dealing with.
So how's he going with his arthritis?
He's going okay. He still has trouble walking a little bit, getting up and down. His arthritis really affects his personality. If we can't manage it, he's like a different cat. He's depressed, he's sad, he doesn't want to interact.
Okay, shall we get you on the table?
Okay, I'll put him on there
Yeah,
for you.
wonderful. Let's get started. So Nero is an interesting patient. He's one of my older patients with a lot going on. Like, what isn't going on with him? He's got a heart murmur, he's got kidney disease, he's got high blood pressure, and a really sore back. So I presume you've told him what I'm going to do to him today?
I have. Come on.
So
So I'm going to take some blood from his jugular and we're going to send that off to the lab. So we're just checking his kidney parameters. So I will compare that with last time and just see where that's sitting. And then also the blood pressure, which he doesn't like too much, but it's not painful. Just want to get a reading and hopefully that's back down to normal levels as well.
Whatever.
Is he saying whatever to me?
Whatever. It's kind of, you're getting the paw.
I'm getting the paw. Mum is seeing a paw right now. So I'm going to take some blood from his jugular and we're going to send that off to the lab. So we're just checking his kidney parameters. Some cats will sometimes twitch when I feel around here, and that can be because of the arthritis. And we'll see what we can do about that.
Simone says when Nero is feeling better, he's constantly talking to her.
I am on call 24/7. It's like having my mobile number on as his hotline. Doesn't even matter. It doesn't matter if I'm on a call. He can break that call, stop it, and make me talk to him.
All right, should we get started?
Yeah, let's do it.
He's not very chatty today, but it turns out Nero's got quite a soft spot for Audrey.
Audrey's energy is really approachable, but not only is her energy approachable, Audrey's energy is grounded. And she holds the space for him. So that entices his trust. If you can get his trust, he'll nearly let you do anything to him. It's all right.
Let's get your little blood pressure cuff ready.
Lately, Nero's blood pressure has been on the high side, which could lead to organ damage if it's not kept under control.
So we've taken the blood from Nero and we've taken his blood pressure, and I'm really happy because his blood pressure's back down to normal. Sitting at 120.
Is that good?
120 is pretty good.
Thank God.
So he was up to the 200s,
Yeah, he was
which is
really
pretty
bad.
dangerous.
Yeah, I know, so worried.
Yeah, that high blood pressure can cause a lot of damage to the kidney itself, but also to every other organ that the blood runs through.
Yeah.
So that's one tick. The next thing is going to look at his arthritis. Shall we have a look at him walking?
There you go. Off you go.
Well, yeah, he does look really sore, just the way he's moving those back legs.
Okay.
Yeah. So arthritis is pretty painful for a cat because if it happens in that lower spine joint, it really makes it immobile. It's crunchy, they lose their cartilage and their lubrication, so it's really sore every time he moves to walk, to groom himself. I'm keen to make him more comfortable. We have to bear in mind that he has got a few other things going on, the kidney, the heart, the blood pressure. So I'm thinking of a supplement that you can add into his food, and it's going to provide him some comfort. It's actually made out of green-lipped mussels, and it's got all those omega-3s, which are good for inflammation and pain. It's got chondroitin in it, which is really good for cartilage health. So all of those things will help, and it won't affect his other problems.
Oh, fantastic.
With the capsule, we're gonna break it open and actually sprinkle it on top of his favorite meal. So in Nero's case, that's chicken.
Oh my God, if he eats that, I'm gonna be over the moon. Oh my God.
So that's really great. That's exactly what we wanted. He loves it, just once a day into his food, and I think you're gonna see a huge improvement.
Fantastic.
So I'm hoping that in 4 weeks' time, Nero will start to feel a lot more comfortable. He continues to eat the supplement, which is good for him, and we get all his other problems under control. All right, see you. See you next time.
Bye. You gonna wave the guy? Bye. See you later, Audrey. See you later, Bree. Bye.
Hey kiddo, let's have a look at ya.
In Miami, test results have come back after Edward biopsied King Charles Cavalier Harley to find out why he was suffering serious intestinal issues.
This does look scary.
Unfortunately, the tests confirmed Harley does have cancer. He is now receiving treatment for the condition from an oncologist. As for talking cat Nero, he's moving a lot more freely, and owner Simone reports he's a lot happier.
He can jump up and down the bed, sofa, and he's got quality again. As long as he's got quality and he wants to be here, I'm happy.
Hey.
And 4 weeks after his cancerous front leg was removed, Archie is adapting well to life on 3 limbs.
What are you doing? What are you doing?
Adoring owner Lauren is thankful for every new day she gets to spend with her lovable 6-year-old best friend.
You did it, Arch. You did it.
If you guys loved that video, great. Make sure you subscribe to our YouTube channel below. That way.